back, Straight Talkers. Today I'm going to talk about the medication Focalin so that you can be better informed when deciding whether or not to start this medication. But first, please make sure you hit that subscribe button so that you can be the first to know when new content comes out. Each medication typically has a generic name and a brand name, and doctors will often use these names interchangeably. So Dexmethylphenidate is the generic name, and Focalin is the brand name. The generic medication has the same chemical formula, but it may or may not be exactly the same strength as the brand name medication. So how does this medication work? Focalin is a stimulant medication, and it works by increasing the activity of the neurotransmitters dopamine and norepinephrine in certain parts of the brain. In adults, Focalin is FDA approved for the treatment of ADHD. It's also approved for the treatment of ADHD in children ages 6 and older, and it's used off-label at times for the management of obesity, treatment-resistant depression, and narcolepsy. So when looking at Focalin, it comes in two different formulations, short-acting tablets or long-acting capsules. And because Focalin is thought to be around 2 times more potent than methylphenidate, the dose amount is generally less. The short-acting form is usually dosed between 5 to 20 milligrams, and it's divided into twice daily dosing. And each dose is thought to last between 3 to 4 hours. The long-acting form is given once per day, and the dose range is generally between 5 to 40 milligrams daily. And it's thought to last between 8 to 10 hours. And the capsules contain 50% immediate release beads and 50% delayed release beads. Therefore, a single dose of the long-acting form of Focalin is thought to provide the same amount of medication as 2 immediate release Focalin tablets given 4 hours apart. In addition, if your child struggles with swallowing capsules, the long-acting capsules can actually be opened and sprinkled over food such as applesauce. If I'm using this medication in kids, my approach is always to start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose that leads to complete remission of current symptoms. Now let's talk about potential side effects. It's important to realize that many side effects are often dose dependent, meaning that the likelihood of getting them increases as the dose increases. Other side effects are also time dependent, meaning that they begin immediately upon starting the medication or whenever we make a change to the dose of the medication. But what we see is that the side effects typically go away with time as your body gets adjusted to the medication. So the common but usually more mild side effects of Focalin include decreased appetite, headaches, indigestion, and anxiety. More serious but less common side effects can include slowing of growth in children, seizures, cardiovascular events, priapism, or eyesight changes and blurred vision. It's also important to realize that taking multiple medications at the same time may cause one medication not to work as well, or lead to an increased likelihood of potential side effects. So you should always talk to your doctor or pharmacist before starting a new medication, and definitely make sure that your doctor has an up-to-date list of all the medications that you're currently taking. Thanks for watching this video. Now head on over to the next one to find out more ways that you can help your child live their best life.